I am Dr. Mahesh Goenka, a gastroenterologist and hepatologist from Apollo Clinicals Hospital, Kolkata. We are all going through the critical phase of corona pandemic. The two most important aims for anybody today are to avoid to get this infection yourself as well as to avoid spreading it to others. The social media is full of information regarding COVID-19 and most of it is correct. Some information is however not based on evidence. Myths and rumors needs to be avoided. As a gastroenterologist taking care of GI and liver diseases, I have a few suggestions which can help you in contributing to the containment of the disease. First and the foremost is to avoid visiting hospitals for minor self-limiting diseases such as mild abdominal discomfort, gas, nausea or constipation. Even an illness like jaundice, if it is not due to obstruction of the bile duct due to tumor or stone, can easily be managed at home. If you have any doubt about the severity of your symptoms, one option would be to have a telephonic conversation with your family physician who can then guide you about the need to see a specialist or necessary investigation. I must, however, inform that diarrhea can be present in 5 to 50% of the patients with COVID and should not be neglected if associated with fever, cough or sore throat. If it is required that you have to visit a medical facility, please go there with only one responsible family friend or relative. Idea is not to crowd the hospital. If you do go to the hospital, please declare as soon as you reach there about your travel history to COVID-19 areas, particularly international travels in last 2 to 3 weeks. Also disclose classical corona symptoms like fever, cough, sore throat or difficulty in breathing. Hiding these facts can only harm you and people around you. Most of the hospitals during this period are avoiding non-emergency invasive procedures including endoscopy. Only patients with serious illnesses like bleeding from GI tract, obstructive jaundice, accidental foreign body ingestion, inability to swallow, or those with high probability of cancers are to be subjected to endoscopy at this time. Endoscopy can be a way of transmitting the virus both ways, and it should be performed only in hospitals equipped with proper sterilization facilities. Most of the medicines which you may be taking for a long term for your GI and liver diseases can be continued at this time, but it may be a good idea to reduce and rationalize immunosuppressive drugs including steroids. However, these drugs should not be stopped suddenly. One information which is important is that we all know that coronavirus is primarily transmitted through droplets and enter the body through the respiratory system. However, fecal-oral transmission cannot be excluded altogether with our current knowledge. Hand hygiene, therefore, is of paramount importance, particularly after using the toilets. I would also, as a gastroenterologist, emphasize that you must keep your immunity high by taking a good nutritious diet, drinking plenty of water, particularly warm water, and sleep well. Prophylactic use of drugs like hydroxychloroquine has been advised primarily for those who have relatively high risk, such as healthcare personnel, and maybe for those in contact with proven COVID-19 patients. This drug is also not totally safe. Finally, while we are in the critical phase of COVID-19 epidemic, mantras has to be physical distancing, remaining indoor, and of course hand hygiene. Thank you. Stay safe.